What's up, you guys? This is your boy Miguel giving your daily dose of radiation. In today's video, we're covering why night shift techs dread working the day shift, especially when they're called in. So, to give you context, I am a night shift Xray tech. Work a lot of overtime, so I dabble in both teams. I don't really mind working days versus night. I mean, I would prefer nights, and of course, if there was always opportunity to work overtime at night, I will, but not always is that the case. Sometimes I have to work days because there's more positions in daytime, whatever. So I would say some of the reasons why certain techs would dread having to work the day due to the different workflow. Different techs are involved, different doctors, and different dynamics versus the night shift. I guess depending on your hospital, most places, if they're lower level traumas, they do not level of trauma 1, trauma 2, trauma 3, whatever urgency. Like ours is like a trauma 3. So we overnight do not have a rad. So we don't really do fluoroscopy at all unless it's super urgent. Versus daytime, you have an in-house radiologist, RPA, or whoever, and then you have certain techs in the main who do the fluoro and stuff like that. When you work night, usually your fluoro game, your knowledge over time, because you just simply don't do it. You may have a basic understanding of it, but you're not hands-on doing it every time. So your day-to-day skills-wise drop significantly, especially the longer you're on nights, your skill level will drop because you just don't simply do it. And majority of the time, you just don't. Obviously, you're still supposed to know it because it is part of your job, and occasionally it's a tiny 1% that does happen that you do have to do it. There's always a small, tiny chance. So, continuing on. Even though, let's say where I work, it's just nighttime. It's in the ER, right? We stay in the ER for a majority of the time, and then occasionally we'll go to the floor for morning ports or other stuff like that. The way we've had our little workflow structured is completely different versus daytime. If we're working nights, okay, you stay in the ER. If you get called to the floor, only if you get called to the floor do we go to the floor. So that's a different dynamic. Versus daytime, they will just keep on putting orders after orders after orders on the floor. And some people kind of dread that. Or you get called to do this or do that. And the workflow, even there is technically more exams they get performed during the daytime or ordered during the daytime, but there's more techs. So you could say that the workflow gets distributed amongst the techs, which, depending who's working, could also determine the flow of that too. Let's see what else. During the daytime, you have all the managers, you have way more people in your way to even perform exams, which gets kind of annoying, especially if you go on the floor. There's more people in the way. I would say there is 1/4 staffing involved during the nighttime versus the daytime. So that is crazy amount more. Just that part right there is completely dreadful to some techs. What else? I would say that most of the time, even me, the way I structured my life outside of work, I've guessed because I've just worked night shift so long that everything outside of work kind of works. I've just had it niche to where it goes smoothly. So if I work daytime, I would have to rearrange, and my body has to readapt completely different. So it could cause some, not imbalances, but it would cause some changes in how my life outside of work goes. So I could see how that could be a reason why people like wouldn't want to work daytime, or like they would dread getting called. Even though if you do get called in, you'd get paid like overtime, and you'd get called like on-call pay, which is it's a little change. You know, it's not crazy amount. Another thing I would say is you have, I guess, different work dynamics. If you like go from like working solely night, you don't really know none of the staffing, so it's like harder to kind of like, especially in the ER, if you know like certain nurses, or you know like kind of what's happening, you're able to like kind of like sneak in or kind of do something, or people are like more lenient. And during daytime, I've noticed the nurses, other medical workers aren't as lenient to, like, it's not like a team. It's like in the nighttime, if you work in the ER, let's say, everyone is working as a unit, as a team to complete, to discharge these people, send them home. We work a little cocoon, little squad. And then I feel like in daytime, because the sheer amount of people, the whole ER doesn't work like a unit. It works like individually. So like Xray, nurses, their own little squads. So it's more of like fighting to get your stuff done, versus like at nighttime, it's like a more smooth, like since there's less people, you get to know people. Like it's a more, like a better experience, I would say, especially like that. That could be another reason why. What else? During the daytime, doctors will order a bunch more exams, certain exams, post-surgery. Since a lot of surgeries happen during the daytime, you can see a lot of post-exams, like post-hip, post like neck, C-spine, L-spine happening. So majority of the times, even though we have our own surgical techs, they only do like C-arm, and then once they go to the floor, the doctors will order like standing C-spine with C-collar, like because they have, or like overnight we'll do X-rays, and then, or maybe a trauma came overnight and then it went, and then the patient got admitted and they're on the floor. And maybe on this, like on the CT, they saw like possible like neck fracture or something. Then they'll order a C-spine, which will have to be, and then certain doctors will have it standing, or needed like this or needed like that, which it just takes longer. It's harder, even though they already know what it is and why it's broken. They just require different films for like orthopedic, for neurology, for there's different reasons why they would order these exams, which all those happen during daytime. And they can get annoying. Especially certain doctors will want stuff, especially like for surgeons, especially if they get like the little, what's it called, like the C-spine, the little plates or the little screws, the one like spot on perfect. Most of the time, if a patient's fresh out of surgery, they're not exactly in the best condition, and the best, like there's kind of always a little between us and the surgeon or the whoever orders it, because you'll do the best. Sometimes the patient can't. Like we'll try to adjust, we'll try to do everything. Sometimes it's not the best situation, and then the manager gets involved, and it can get bad. As a night shift, I've just been told a lot of stuff that happens during the daytime, and then nighttime, we never experienced that. So like, I can see why most people, especially if you are already working night shift, you could dread working the day shift. That's some of the things I think would be hindering. Yeah, it's been your boy Miguel. See you on the next one.